I've been sitting here just talking about things that I had not even put on the button to start. What I was talking about was nursing. Nursing is a profession. A lot of people want to say that nursing is not a profession, but yes, nursing is a profession. I think nurses should be ranked up there just as high as lawyers, teachers, doctors, what have you. It takes a lot of intuition, great skills, know-how to really feel your call in nursing once you become a nurse. I feel that nursing, without the nursing staff, the doctors wouldn't know how to really treat their patients. They wouldn't know how to treat the well-being of the patient if the nurses were not communicating between the patient and the doctors and following through on what's best for that patient. Doctors have a great responsibility on their end. I'm not knocking them whatsoever, because doctors are great. When you get a good set of doctors who are caring and believe in what they're doing for the cause that they're doing it for, they are great. But like as in any profession, you have some who care and some who don't. And just like that, it goes in nursing too. You know, we as nurses, we love to do things for our patients. We advocate for our patients. We assist our patients. We build a trust and rapport with our patients. We try to make sure that the medication that the patients are on coincides with the well-being of the patient, looking at labs, treatment, medication regimen. We as nurses, we do that. The diets, the intake and output, we as nurses, we evaluate those things. We do that. That's how we let the doctors know what direction you, the patients, may be going in. So I feel like nursing is a profession. And we're not here to replace any other professions. We're just here to try to make sure that the well-being of the patient is taken care of. With that being said, you know, a lot of people feel uncomfortable about nurse practitioners. Nurse practitioners came into the field because of the decline of doctors in the field. There's not as many doctors in the field out there. And so that's how nurse practitioners came about, because there are doctors who may be more in the urban fields or the urban sector, but what about rural areas where a lot of patients may be in that need care, that need assistance, that need medical expertise or nursing expertise for that matter? The NP looks at the patient holistically, the health, the well-being, the family, the community, mentally, physically, emotionally, spiritually, you name it, the nurse or nurse practitioner does it. It's the holistic being of the individual. So with that being said, there is a great need for nurse practitioners. Now, I know a lot of people may have a stigma with nurses becoming doctorates of their practice and being called doctor, which in the realm of their profession, yes, they are a doctor. You know, if you make it to doctorate of nursing, yes, in your profession, You are a doctor, but it's not to replace the MD or the OD who are doctors of medicine or doctor of other practices of medical nurse of medicine. Oh, I'm saying that wrong. Of medicine. So, with that being said, you know, I feel like in the right perspective, if a nurse goes back to get their doctorates, they're within their rights to be called a doctor, but not to replace the medical doctor who went to school to be a doctor of medicine. So that's just my soapbox on that. Patient care. We as nurses, we do a lot. You know, sometimes we don't have. We give meds. We do patient care. We do therapy. It's just we calculate intake output. We may have to feed patients. We may have to change patients. We may have to bathe patients. We may have to, communicate between the doctors, carry out the orders of the physician. I mean, nurses do a lot that we don't get credit for. So as a nurse, I'm proud to be a nurse. I'm seeking to go higher in whatever aspect I can go in. But nursing is a great profession. The only thing that I have reservations about is burnout. Nursing is a burnout profession as well. That's why, as a nurse, you got to keep your own mental health in balance. You have to keep your own physical health in balance. Because if you don't care for yourself, how are you going to care for other individuals? That's just my soapbox for today. I hope you guys enjoyed the talk. Whatever you have questions about, whatever your concerns are, whatever your opinions are, please message it. Let me know. And I'll try to get back and answer the questions to the best of my ability. Thank you, and have a great rest of your day.